Start the examination of the outer ear by exposing the whole ear by putting aside any hair and just looking for any signs of inflammation, and also particularly at the back, checking the mastoid isn't tender and swollen and inflamed. And I often ask the patients very gently if I move their ear whether it hurts. So may I move your outer ear gently?
Yes.
Because if they've got an otitis externa, that would be very uncomfortable, and what I do is this, just gently pull up and back. Is that okay, Narushi?
That's okay.
This is a typical otoscope with a speculum that has a small bevel that rotates on to make sure it doesn't fall off. You turn it on, and it's important to realise that this is for holding the batteries. This is not for grasping the instrument. The best way is a 2 fingers and thumb approach from underneath, which is a very delicate way to hold this instrument. It frees up your little finger, which can then be placed against the cheek, especially of a child who may move suddenly, and if that was to happen, you move with them. So, very gently, as before, we've checked that the ear is not tender, and in an adult, it's helpful to straighten the ear canal by gently pulling the pinner up and back like this. There's no real need to do that in a child, and indeed children rather resent that and start reacting rather adversely if you do that. And they have quite straight canals, but in an adult it can be very helpful to straighten the canal. Then very, very gently, looking at what you're doing, not looking through the lens at this point, you place the end of the speculum as far as you can see without hurting the patient. You don't want to ram it up against their external canal. And that's as far as I can see, obviously. And now you look through the lens, and you will often find initially that you're looking directly at the skin of the external canal. And then you have to very gently move it, so usually towards the nose or the forehead of the patient, usually anteriorly, before the tympanic membrane comes into view. And you will only see part of the tympanic membrane at this point. It's important then to be moved gently, move up, move to the down, and move slightly posteriorly and further up. And you are looking initially for the light reflex. That's a very good place to orientate yourself for the light reflex, to make sure it looks normal, to make sure that the tympanic membrane is a nice pinky grey colour that's glistening, and then keep going, looking all the way in the pars flaccida and in the attic region, and then having finished, just gently coming out. And now to examine Narushi's right ear, we change hands. So you hold the instrument in the left hand for the left ear and the right hand for the right ear. Again, gently extend and pull back the pinner, gently place the tip of the speculum in the external canal, and then look down the lens before you can move it slightly to gain a good view of the tympanic membrane.